Hello, everyone. My name is Erica Bailey, and I'm here with Push for Empowered Pregnancy. And I'm here with Dr. Heather Florescue. And today we're going to talk to you about everything you need to know about fetal movement and why it's important for every single pregnancy and every single patient. Before we begin, for those of you who are not familiar with Push, I'd just like to tell you a little bit about why we're here and what we're trying to accomplish. So 65 babies are dying in the second half of pregnancy every single day in the United States. This is unacceptable, and it's beyond time for change. Push for Empowered Pregnancy exists for one reason and one reason alone: to kickstart the pace of change in the US using big, bold, innovative action to save as many babies' lives as possible, as quickly as possible. Most babies lost to stillbirth are otherwise healthy, and all of them are deeply, deeply loved. My son, Roan, who died days before his due date, was one of those babies. And we at Push are a diverse coalition of bereaved parents from around the country, and we are working closely with trailblazing medical researchers, courageous doctors like Dr. Heather Florescue here, and other hardworking allies to drive down the incidence of stillbirth in the United States over the next decade by any means necessary. No family should have to endure what we have endured. And that's why we're talking about fetal movement education today, because this is one of the tools that we have to prevent preventable stillbirth. So first, let me pass it to Dr. Florescue. I'd like for you to introduce yourself and tell us how you became involved in this space and are so passionate about this topic.
Hi, everybody. Thank you so much for having me. How did I get involved in this? It's always such a bizarre question when people ask, because I always say to people, I have no idea how I became where I am today. I always enjoyed taking care of lost families and kind of really providing, I hope, great support after they lost their babies. And I kind of naturally always did what the Rainbow clinics that Push has started did. And that kind of led to me going to the Star Legacy Summit in 2019. And then I heard Dr. Calderwood say that stillbirth may be preventable and that there were protocols to do this. So I went home with my usual Heather enthusiasm, and I tried to get everybody to jump on board that stillbirth is preventable. And I felt like a lot of resistance to it. And then I kind of thought back to all the things in history that needed to be changed, and that every single one of them was a huge fight. And I thought, if I'm having to fight this hard for this, it must be something that needs to be changed. So 3 years ago, I incorporated the protocol in our practice from the UK. And really what we do is great fetal movement education and follow a very standardized protocol for when somebody calls our office with decreased fetal movement. One of the things that's very obvious to me is when I thought back on my residency and I took care of term stillbirths families, often that patient did not present with decreased fetal movement. They often presented in labor or because their water broke or because they had a headache. And I used to think that they must have just been in denial, that they clearly knew that the baby was not moving, but they just couldn't face coming in. So they came in for another reason. And I've learned that that is so not true. Women and men just don't know that decreased fetal movement is a sign that their baby could be struggling. And I don't want to scare the patient, all those kind of things has led to barriers. But every single pregnant person who's listening to this is terrified of eating, deli meat. And so we've conveyed that really well. Why are we being patronizing and not actually educating about fetal movement?
Yeah, I couldn't agree more. And I experienced the same thing with my first pregnancy. I was not educated about fetal movement. I was asked at every appointment, is your baby moving? Which we'll talk about later is not a very good question to ask. It's kind of close-ended. And my baby was moving, but his normal patterns had changed. And because I had believed all the myths that I read online and in mom groups, I was unaware that that was a sign that he was in distress. So you talked about it a little bit, but if you could expand on why fetal movement is so important.
So my thought in it is that it is the low gas warning. So Dr. Kleiman talks about this as well, that what does a baby look like right before it's about to die? We don't know, right? Because somebody shows up with a terrible tracing, we deliver them. And I truly believe, because I've even heard stories of patients getting a labor check and the non-stress test looks normal, and then they come back 2 hours later to be rechecked and the baby has died. So clearly we can't just go based on what that monitor says. I think there is really no test we have now that is better than a person's instincts. And I think when we're not feeling our babies move right and we're worried about it, that our instincts are what should be the number one thing that we're listening to. And I think when a baby's not moving, we think about if you've had COVID or you've had the flu and you're not moving as much, you're not exercising, you're kind of lying in bed. Think about that with your baby. Your baby's not getting what it needs from the gas tank anymore of the placenta. Your baby's going to say, let me reserve all the energy I possibly can, and I'm going to move less. It's so logical, and we just need to give people those logical points.
Yeah, and it's just the same as, if you think about someone who has a live child outside of the womb and you see your child not acting normally and they're acting very lethargic, what would you do? You would take them to the pediatrician to get them checked. It's the same thing when us pregnant people, when we feel like our baby's movements have changed and something feels off, that's what we need to do. We need to go in. So my next question is, this is kind of a loaded question, but what needs to change in terms of standardizing fetal movement education and management? Because right now, as we know, as patients, as you as a provider, there is no standard. Where you go, you don't know what kind of education you're going to get. When I was pregnant in my first pregnancy, I was not educated on fetal movement. I was only asked, is my baby moving? I was never asked any questions about how my baby's moving, what his patterns were, anything like that. So can you please tell us what needs to change and move forward here for education and management?
Well, obviously, I think that every practice needs to follow what we're doing. So I think answering that question based on what we're doing is probably the best way. So I do a chart review to prompt all my partners, but most of them are just doing it right off the bat anyway now. So we have the card to talk about fetal movement. At 20 to 24 weeks, we introduce fetal movement education to the patient. We talk about normal fetal movement. We talk about getting to know their babies. We encourage the card to go on the fridge. And I think my biggest part of what I say to patients when I show them this card myself is they need to trust their instincts and they need to call. And I mean this in all kindness to all female family members who are listening right now, but it is rarely the partner that keeps that phone call from happening. In my experience, it is well-meaning family members who just don't want that pregnant patient to be anxious, who say, you know what, let me bring over the home Doppler. No, no, no. Or they say, your baby's just sleeping, your baby's running out of room, because they want to reassure. Please don't reassure a worried pregnant woman. That is not your job as the loved one. If they are truly worried, the best thing to do is call the office. And so I say this very directly to the patients. And I say, you're never bothering us. That's what we're here for. I make the joke that my best friend's a dermatologist, and if I didn't want to work weekends or nights, I would have picked another profession. So really just conveying to people. And I always say to people, this card isn't just for fetal movement. If you have a bad headache, you're itching, you're worried about abdominal pain, please don't turn to your family members. Please don't turn to the nurse member of your family who knows everything about everything. Please don't turn to the internet. Just trust us, call us. That's what we're here for. And so I think it really is setting at the important midway point of the pregnancy, you're never bothering us. And you really have to convey that again and again. There are patients who call us regularly all the time, not even lost patients. And we always are we're never the boy that cried wolf in this practice. And that is so important, because sometimes somebody will call about something that is kind of funny, at all hours of the night, but then the next day they are calling because their baby's not moving. And we want to take every call seriously, so they always feel empowered to continue calling our practice. The other critical thing that we do is, again, asking, I say, any concerns about fetal movement today? It's actually no extra words, really. It's just an open-ended way to ask the question. And then when they do call or they do mention at the visit, we use the UK protocol. And really all that is doing is, again, I said NSTs are not the all and the end all. So we're doing the NST, we're doing the fluid and growth check that are part of the protocol, but also in the protocol is, are you reassured? And if they're not reassured, my nurses will find a provider and say they're not feeling reassured. And one of the things I'm very proud of is I don't think the residents, newer residents, even know that this is me like battering this into people, but when they call me about decreased free movement now, they say, and the patient was reassured by the evaluation. And I cannot tell you how hard I've had to fight for patients who are not reassured, but then NST is normal and the ultrasound is normal. And I've really very bluntly said right in front of these patients, do you see that you're still worried, even though you're telling her the NST looks good? And really trying to teach our future generation to listen to the patient over the monitor. So when somebody calls my office, they are never going to hear a myth. They're never going to hear somebody say, oh, that's normal. They're going to say, I hear you're concerned, and what can we do to reassure you that your baby's okay?
Who is typically the one answering the phones when patients are calling in? Are they speaking to a registered nurse, or who do they get in contact with? Because that is one of the issues that we're facing, is who is answering the phones for these concerned parents, and what were they trained on?
Exactly. So one of the things is in New York State, and I can't speak to other states, it is against the law for anybody to triage a patient who is not an RN. And that does not mean LPN. They have to have an RN degree. And that is something that we value so much. I always joke around it costs us a lot of money to have many great nurses, but that is so important because the secretaries in our office, they know not to get a history from the patient to say, oh, I hear you're concerned about decreased free movement. A nurse is going to call you right back. Because you were completely right. If somebody is answering that phone and they are empowered to give their own advice, because they, trust me, our people who work the front desk at an OB/GYN office, they know a lot about pregnancy. They hear all day patients calling, but we really just have to empower the people who work at the offices to say, that's what our nurses are for. That's what our providers are for, because you're completely right. There are patients who've called and have been condescended to in other practices and said, I don't even know why you're calling. Your baby's just running out of room. And then they're not left to feel empowered by the call. And as I said, that's, I think, one of the biggest virtues of following a protocol in our practice is our patients feel empowered that they did the right thing. The vast majority of the time, everything is fine. I mean, far and away. But then they were like, oh, they took me so seriously. I'm going to call because now a week later, I'm still not feeling, reassured. And it's all about empowerment.
Yeah, I couldn't agree more. I also want to point out that a lot of times when patients call, we get a recording and we have to wait for a call back. So in those cases, I would tell people just to go into triage. What would you say? And
I think, so I will tell you, my pregnancy after loss patients, they just show up in triage. It is helpful to try to call if you are going in because you're so worried. All you have to do is tell the entering service on the way, I'm coming in, I'm worried about decreased fetal movement. It is helpful to let the labor and delivery team know because they have nurses that are shifting around. The more they know who's coming, the better they can care for people. So if you are convinced that you are just going in regardless, that is always okay. But if you can give an FYI to the on-call doctor, it is helpful.
Perfect. So I really want to get into the myths here. I'm seeing a lot of them come up in the chat, and we really just need to debunk a lot of these because they spread like wildfire, especially in the mom groups, especially on the internet, especially with family members, grandmas, aunties, everyone. So let's get into it. The first myth, kick counts, getting 10 kicks in 2 hours.
Yeah. So I think this maybe came to be that babies who are kicking 10 times are not supposed to be acidotic. But to me, it's all about the decrease. And so if a mother usually has a 5 to 10 kick per hour baby, then they're reassured by 10 kicks, right? But there are some women who have 100 kick per hour babies. And it's hard to say, oh, you should still be reassured by something that's a 90% decrease. So I think every baby is totally different. I have almost 15-year-old triplets, and I will tell you every single one of them had a different personality in utero. And I think anybody who's been pregnant multiple times knows that. So it is the individual baby and what is normal for them. And there are some babies that don't move a lot, and that 10 kicks might be plenty, but there are babies who are constantly moving and they need to have a different kind of result. So it's, again, the kick counts are wonderful to get to know your baby. And Eric and I were talking about Count the Kicks is definitely the app we want you to use, but that is to get to know your baby. If you're worried, don't even worry about the kick count. Like, just trust your instincts and give a call.
Yeah, your intuition as a parent is powerful. And I know I've seen this in the chat and I've experienced it myself, that when you're going through pregnancy after loss, especially, it's hard to discern between anxiety and intuition. Mm-hmm. When in doubt, trust it as intuition and get checked.
Yeah. Another thing to the intuition, I just want to make sure very clear. Even if you trust your intuition and you lose your baby, that is never your fault. It is the fault of education. It is never your fault. We know that we cannot prevent all stillbirths. So please, 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 anybody who's hearing this, if you don't get the instinct and something bad happens, that's not your fault. And if you do get the instinct and something happens, still not your fault. It is our job, though, as providers and a community, to make sure that we are giving correct information and that patients, as I said, aren't showing up for a labor check. And when we say your baby has died, oh, when did you last feel your baby move? Oh, I don't know, 3 or 4 days ago, but people told me that was normal. That's what we're trying to get rid of today.
Yes. That was my lived experience. So yeah, I agree. Myth number 2, fetuses slow down at the end of pregnancy or they run out of room.
So I always tell people, could the quality change a little as your baby's putting on half a pound a week? Potentially, but what they've done studies where they put basically Holter monitors on babies for 24 hours and monitor the movement instead. And they've actually seen an increase in movement as babies get closer to term. And I think everybody has seen somebody, in labor, when we take care of them, that we can see the baby moving while they're fully in pushing. So really and truly, this kind of they run out of space isn't really true. I see 39-week babies that I'm examining, and I do my Leopold's, and the mom and I are laughing because there's limbs moving everywhere. So you should never be worried about your baby. And these are the myths. As I said, I don't know that these are entirely given by care providers. I think there really is this disconnect between the maternal worry and family members, friends, internet, convincing somebody not to make that phone call.
Yeah, I think a lot of times it's well-meaning people whose babies were born alive despite that their baby's slowing down at the end of their pregnancy, not because they slowed down. So, like you said, 99 times out of 100, baby will be fine, but it's that one time that it happens.
Yeah.
All right. The next myth that I was actually told by multiple people was, when my baby wasn't moving like his normal, to try drinking juice or ice water or eating something sweet to get my baby to move.
I think the idea of this, I think, is that you give a little sugar, maybe the baby's not moving because you need more calories. I still have women who come in to their appointments and say, I was a little worried last night about the baby, so I drank some juice and the baby instantly started moving. So I don't think that alone. It's more okay, you drank the juice and 20 minutes passed and you're still worried, you're picking up the phone and calling. So I think there are women who will drink, or pregnant women will drink the juice and then they'll feel instant reassurance. But then there are people who drink it and are like, oh, maybe they moved a little, but they moved. And so that's the big thing, is if we're making sure people know that you should be completely reassured. If it was totally that your glucose was low and baby just needed a jolt, you should know that your baby is okay immediately. Same thing as I actually tell pregnant patients to move the limbs around. You can touch the baby's head, move it around, and your baby should respond to that too. And there are ways to quickly do an assessment that may reassure you, but literally you give that 10, 20 minutes. And if you're still feeling like this is not right, please don't wait longer, just call.
Yeah, it's like when your child is outside of the womb and they're not feeling well, would you give them something sweet to would that reassure you as a parent? Probably not. Yeah. At best, it's just going to delay you getting treatment if your baby really is in distress.
Yeah.
This is an important one. If someone is experiencing increased fetal movement that does not feel like their baby's normal, that's not a concern.
Yeah, I would say since we put the protocol in, we probably have had that call 2 or 3 times. So it's definitely not common, but it is definitely well known that some babies, unfortunately, I don't, maybe they are hitting the gas, of that kind of car analogy, to see if it can rev them up, or maybe it's a sign of stress. When they've looked at the studies on this increased movement before stillbirth, the adjectives seem to be very important. So I tell people, if you're videoing your belly and you're laughing because the baby's moving so much and you're like, oh my God, this is so crazy, and you're bringing your family over to watch, that is probably not concerning. If you're feeling stressed about the increased movements, if they're feeling negative adjectives, frantic, crazy, those kind of things, seizure, people start to use these kind of negative terms for the increased movement, that is definitely a reason to give us a call.
Yeah, I think a lot of stillbirth parents, including myself, experienced this before our stillbirth happened. And I remember it just feeling it was very violent and
Yeah, sorry, that's
exaggerated.
another good term, violent. Yeah.
And because it was my first pregnancy, I really didn't have a clue that this was not normal. I thought, well, maybe this is what triggers labor. He's just punching his way out, and he was in distress. And I didn't know because I wasn't informed. So that's so important.
And I tell people, if you ever experience, even if they're not using those adjectives, but the baby seems to be wild, whatever terms you want to use, and then it's decreased, please call us immediately as well. So, I tell them, if you have this really active stage and you're a little worried, but then it goes back totally to normal, baby's probably fine. But just, if you need to run it by us, again, the biggest mantra is trust, call. That's what we're here for. And if you don't feel like you're getting that from where you're at, then, seek elsewhere, because really the job of an OBGYN group is to provide reassurance.
This is more of a logistical follow-up question, but let's say a parent is concerned. Do they need to go to the hospital that they're giving birth at, or can they just go to the closest labor and delivery to them?
Yeah, so that always, in the days of electronic records, but I will tell you, you get better care when people have access to your records. And if you're going to an outside hospital and they can't get your records in the middle of the night, that can be a detriment to your care. Probably the safest thing to use is use your big words and, get somebody to listen to you. And if you're not feeling heard, use the words. I am not feeling heard. I don't feel safe. Say you're not leaving the hospital, especially if you're at term, without a plan to deliver the baby. All those kind of things. Using strong language usually will get people to kind of listen more. It's hard to advise to go to another hospital because, as I said, if there's lack of access to your ultrasounds, lack of access to your labs, lack of access to the care you've been given, that can be a detriment. So you have to be careful with the pros and cons. But I want to believe truly that all people want to do the right thing. Nobody wants their patient to experience a stillbirth. It sucks that sometimes you have to advocate at the top of your lungs for it, but that is okay to do. And if somebody's not listening, say, I don't feel like you're listening to me. I think this baby is in distress. And like my patients have said to me, I understand you're telling me the NST is perfect. I understand the ultrasound perfect. I am not comfortable. And I really want to hope that, we go into this because we care, and that's going to make somebody's ears perk up. And that's what we're here for, right? Is we want to get, just like my residents, without me even knowing that that's why they're doing it, are saying, are you reassured by this valuation? It is getting that into the education system, so our new doctors and nurses know exactly what that word means.
The next myth I want to discuss is that all patients know already that a change in fetal movement is a risk factor for stillbirth.
Nope, nobody knows. So I'm hoping that I'm going to get to speak in Washington, D.C., and I'm planning on making my speech showing how many people are going to be out on that, out on the mall and will say, yes, I knew about I knew what to do to prevent Zika. I felt like I was well informed about COVID. I felt like I was I mean, I have never had a patient come into my office who didn't know that the litter boxes need to be changed by somebody else. So they don't know. And as I said, I delivered so many stillborn babies in my career, and very few of them knew that education. And I sat here while we were doing the automac. Sorry, sometimes I lose my professionalism. And I heard the doctor that got picked for that over myself saying that it will cause anxiety. So we need to stop that. Are there some people who may be more anxious by this education, but they're also already anxious about eating the wrong deli meat? So unfortunately, we have to give education to our patients. And if we make a few people anxious, that is so worth the 99% who really love being educated by their providers and need to know this. And again, the things that people think are, well, then we're going to scare them and if something happens. But again, whoever's experienced loss is going to beat themselves up. We need to convey to them that we can't prevent all loss, because we know we can't, but we need to convey that we just want to give you every tool. So if that horrible thing happens to you, you did everything you could. And that's the most important thing.
Exactly. We actually have evidence at Counting the Kicks to show that our app users reported that overwhelmingly the majority of them felt less feelings of anxiety from using the app, and they felt increased feelings of bonding with baby, which helps with ACEs, adverse childhood experiences later in life, if you can bond with baby. So it's just a win-win, like you said, for everyone. And to me, it's no different than when you fly on a commercial flight and you're given the safety demo in case of an emergency landing or a crash.
Yeah.
It's just so you know what to do. And what are the odds of that? Much less than stillbirth.
Yeah. I mean, what are the odds of poison, but we all know we're all terrified of our kids grabbing a medication, this is all just education and making sure that we're doing the best that we can. I can't say we're never going to have a stillbirth in our practice. We have had them, but we can look back and know that we did everything we could. And the patient can look back and say, unfortunately, these things can happen. But our job as providers and our job as, people in the community is post about this, post, everywhere you can, share the card about fetal movement. That more we can be empowering to people who are looking at the internet. And if you see, I'm making these things up because I don't look at these sites, but babybump.com is saying it is normal for babies to slow down at the end. Call them out on it. Say, this is not okay to be posting this. You are giving medical advice. Do not get medical advice from things that are not continually updated to make sure it's current and safe. That is just, unfortunately, this is where it happens. And we just need to be so careful.
Yeah, one of the projects we're working on at Push right now is an internet scrub project where we are finding these sources of misinformation and we're trying to get them corrected. So I just want to point out, just going on this topic, one more point. We're all educated about the risk of SIDS, and not very many people realize that stillbirth happens more than SIDS, preterm birth, car accidents, drowning, guns, fire, flu, poison, and listeria for ages 0 to 14 combined. So we need to be educated on stillbirth just like we're educated on all these other things. The last myth I want to hit on is that fetal movement education guidelines exist and they're easy to implement.
Yeah, no. In my talk that I have given, there are guidelines for things that are far, listeria. I have a great guideline that somebody calls and says, I'm afraid I got exposed to listeria. I have a guideline that I can pull up to go through that. And I think it's 2014 data, but I think it was 25 babies were lost to proven listeria in 2014 in the whole country. Am I sorry about those 25 babies? Of course, but we need to get this something out from ACOG that tells people this. ACOG is amazing. I get so much amazing education, and I read the journal every month, and I do these things. And unfortunately, the Affirm trial that was done gave more nights to say, we're not going to talk about this. And if you guys aren't familiar with it, it was a well-designed study, but I think it was incorporating education. But there is a very big difference from saying, here, read this pamphlet about fetal movement, and a provider or a nurse saying, let's talk about fetal movement at your prenatal visit. It is very different, and we need to empower education about this. And if people know to talk about it and they spend the time, you can't just throw this at a patient. But I've also shown, because I've done a video, I can do this education piece in 3 minutes. It doesn't take much. And so we really need to, there's so much that, we are given advice about. We need something that says, even if it says this is not good evidence, at least it's out there. At least it's saying, the British, the health service has a green top on fetal movement, and they show it's good evidence. They show it's not, but more importantly, they're talking about it. There's no talk anywhere about fetal movement it's one of the things we ask every single appointment, but we don't ask correctly, but we assess it. It's on the ACOG guidelines for what you should ask at a prenatal visit. We just need more stuff. So.
Yeah. It needs to really be a conversation every single time there's a touch point with the patient in the 3rd trimester. And like you said, we are inundated as patients with this packet of information at the beginning of our pregnancy, that if it's just printed on a sheet of paper that we need to pay attention to this and it's never brought up again, that makes us feel like it's not important. So if providers can make this a part of every single touch point, it really drives it home how important this is.
Yeah. It's the same as what we do after surgery, right? We tell them, here are the reasons you need to call after your surgery. We don't just hand them the discharge paperwork. We actually verbally tell them. I think, as I said, I think the study was so well designed, but I can't remember the name of the person who kind of talked about why it wasn't well designed, is that it was just not, you need somebody impassioned. We need to impassion as many people as possible to give this education, because my passion makes people listen. And if it's just this, oh, here's this thing about fetal movement, are you really giving the education? Or are you really believing in the education you're giving? And you're not just doing it because you're part of a trial that's telling you to now do this. So I think Dr. Hezel is doing future stuff in this study that hopefully once they kind of tweak and revise, we're going to see, because it did actually show a decrease in stillbirth. It just didn't quite make statistical significance. So I think if this was changed, I have so little doubt that it would be statistically significant.
Yeah. And to me, if it saves one baby, then it's worth it.
Yes.
So let's talk about some tools available for pregnant people to use to pay attention to their baby's movements. And one of the tools that I'm very passionate about as an ambassador for Count the Kicks is their hallmark tool, the Count the Kicks app. I have it here on my phone. And this is a free app that's available in the Apple Store or the Google Play Store. It's free. And it's available in 14 different languages. And it's just a tool. We're evidence-based, so everything we do is based on research that shows that this is a tool to help prevent stillbirth. And at least once a day, while you're getting to know your baby's normal, you would pull up the app and start a session. And then every time you feel your baby kick, you would tap the foot, and it would start timing how long it takes your baby to get to 10 movements. And very quickly, you're going to see what your baby's pattern is. You're going to learn what times of day your baby is most active. And it's best used at the same time every day. So you're comparing apples to apples. But obviously, if you are concerned in the morning and you don't normally use this until night, don't wait until nighttime to go in. Go as soon as you feel concerned, call and report it so that you can get checked. There's also a strength feature. So once you're done with your kick counting session, it's going to ask you to rate the strength of your baby's movements, because research has shown that that can also be an indicator that your baby needs to be checked. So it will give you a scale of 1 to 5, and 1 would be like those fluttery movements, kind of like the ones at the beginning of pregnancy. And 5 would be fierce, where it feels like your baby's limbs are just trying to break through your womb. So you would give a strength rating, and then there's a place for notes. So very quickly, you're going to see what is normal for your baby. And if your baby's normal changes, please call your provider, please go get checked. And like we mentioned at the beginning, every baby is different. Every pregnancy is different. Don't compare your pregnancy to someone else's or your current pregnancy to a previous pregnancy, because every baby is different. Is there anything you want to add about that, or any other tool?
The nighttime piece that you said. So retrospective studies have shown that patients in hindsight think their baby maybe died overnight. So please, 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 if you have decreased movement at night, just come in. It is one of those things that unfortunately, and there's other studies that show that like sleeping, people say they woke up that morning and they were like, that's the best night's sleep I had, that kind of thing. So if you're tossing and turning at the end of your pregnancy and you're really not getting sleep, that's actually, we think, is actually very reassuring. It's okay if you are getting great sleep. But if you're somebody who's tossing and turning and then you wake up first thing in the morning, you're like, I didn't toss and turn as much as I normally do, check on your baby. Make sure that everything looks okay. Because I've definitely seen where with this tragedy, people say the baby was moving fine before I went to bed. And I woke up first thing in the morning and realized I hadn't been moving. And that's, a good thing. Think about getting up and having a pee break at the end of pregnancy, set your alarm to get up and pee if you're not waking up, all those kind of things, just to make sure you're keeping a nighttime eye on the baby.
Yeah, from my experience, my pregnancy after loss with my second son, I noticed that when I woke up at 36 weeks that he was not moving like his normal. And typically before I get out of bed, he would get 10 movements very quickly. It wouldn't even take 10 minutes, and he was moving very slow. So I went to the doctor. I already had an appointment within an hour, or else I would have went to labor and delivery triage, but I had my appointment. So I went in. They did a non-stress test, and they saw that my son's heart rate was decelerating every time I'd have a contraction. So they thought, well, we'll just watch you for a little bit, but I was not reassured. I had already learned the hard way that like my son was trying to tell me something, and we did a biophysical profile and he passed. They wanted to send me home, and I was like, no, absolutely not. I'm not going home. So they monitored me for a few more hours in labor and delivery, and his heart rate just kept decelerating. So the decision was made to induce me early at 36 weeks. And I did the steroid shots next morning. Luckily, I was already at a 5. So my doctor just had to break the water. Second baby, they come a little faster. And my son was born healthy and alive. And to this day, we still don't know why he was in distress. His placenta was not small yet, like his brother, but it did have the same genetic abnormality present in his placenta. So we just don't know what was happening to cause his distress. But because I trusted my instincts that time, and because my providers listened to me, my son is here healthy and alive.
Well, and I'll tell you a story. I had a patient come in who was probably around 36 or 37 weeks, and she came in very worried, came in not reassured. And but the tracing looked fine and everything looked fine. There were no decels. And I said, well, how do you feel about just monitoring you we'll just monitor you till you feel reassured. And she said, that sounds great. And around 1 or 2 in the morning, she goes, this baby is back to normal. I'm totally reassured. Thank you for everything. Sent her home, and she had a beautiful, healthy baby a few weeks later. So it may be as simple as that. This patient went from incredibly worried to, oh, I don't know what this goofy baby was doing, but now I'm totally reassured and I feel great about going home. And I felt great about sending her home because we had all the data that we knew was the baby was doing great, and now mom's reassured and she did wonderfully the rest of the pregnancy. So sometimes it's just, you have to think out of the box, and you have to say, what is the harm of keeping this patient on the monitor and seeing if this baby is going to show its true colors? Really, there's nothing, right? There's no harm to giving you what you asked for that day, and look what it kind of showed.
real quick, before we log off, is it okay if we take a few questions from the chat?
Of course.
So one question is 28 weeks the time to start tracking, or should someone start before that?
I think the data is to give it at 20 to 24 weeks. I think, unfortunately, I will say the 22 to 28 week range, I have a lot of ladies who I think the change in movement is simply too small of a foot, anterior placenta, baby changes position, but that doesn't mean that you shouldn't call if you're worried. I unfortunately, at the earlier gestational ages, it takes a lot to deliver a premature baby because we know that there's so many long-term complications, but that doesn't mean that you shouldn't let us know that something seems different. We, at the very least, we can bring you in and listen to the heartbeat and do an ultrasound and show you your baby moving on ultrasound. I think 28 weeks is when that baby's putting on half a pound a week, and we really would be seeing a more consistent movement. Unfortunately, when they're 1 pound and their foot is an inch or two long, sometimes it's simply their body is too small to get the same consistency we expect. But if you're 25 weeks and you're worried, just call. We'll do everything we can to reassure you, and that's what we're here for. Because if you call it 25 weeks when you're worried, then you're going to call it 37 weeks because you're going to feel empowered by doing the right thing. And to me, this is all going forward. I've had patients call us at 18 weeks. We're obviously not going to do anything, but we bring them in for a heart rate check. But what that says is I called my doctor's office and they took my concern seriously and they listened to my baby for me, and then they're going to call. And that's what it is. It's setting up with patients a really great pattern. So when something really is going on, they feel so empowered because they know that we're going to listen.
Yeah, I wish I would have had this talk during my first pregnancy, but during my second pregnancy, I probably went into triage 6 times. And every time the nurses were so courageous and kind to me and told me, if you need to come in 100 times to check on your baby, do it. Like, that's what we're here for. And that just made me feel so good that I was doing the right thing.
Well, and the problem is we don't want that to be because you had a term loss. We want every patient who walks into triage to have that same empowered thing. And just that's what we're trying to do here. Is I don't want people to have to lose a son to have nurses say you come as much as you want. A patient who has not lost a child should be able to come in and be evaluated whenever they want to be.
Yes. Yeah, whenever I went back and asked why my provider at the time for my first wasn't doing the fetal movement education, her response was she only did it for high risk patients. And unfortunately, a lot of us don't become high risk until we suffer the worst loss of them all. So this is why we want every patient to know, every pregnant person to know about this, because everyone needs to be empowered to speak up for their baby and themselves.
Yes, 100%.
Thank you so much for your time, Dr. Florescue. I do want to put in a small plug for, we have 2 really important pieces of federal legislation right now needing to be approved to help end preventable stillbirth. And the first is the Shine for Autumn Act that is in the Senate right now. And what this bill is going to do is going to provide funding for research, data collection, so we know why stillbirths happen, education and awareness for patients, improve perinatal pathology, so we know like why the baby's had a stillbirth in the first place. And all of these things are going to help lower the stillbirth rate. So if you could reach out to your reps for that. And the other one is the Maternal and Child Stillbirth Prevention Act, or amendments to Title V. And this is in Congress and the Senate. And what this is going to do, it's going to amend Title V so that the government can use Title V funds for stillbirth as an acceptable use of that money, because stillbirth has been left out of that thus far. And part of this that's going to be really important for fetal movement, it's going to help allow funding for program like Count the Kicks to be in even more states. So more offices and health departments have access to these free resources to give to their patients. Thank you so much. Is there anything you'd like to end us on?
No, thank you for doing this. I hope
We
it's
really
something that people
appreciate
can turn to, but again, how we can all make change and how you guys can all honor your babies is share this, post it, get it out there. We need to change the narrative. So yeah.
Thank you so much. We really appreciate you and all the work that you do for our babies.
No worries.
Oh,
Yes.
and the big
Yes.
push. Come
Yes.
see us in DC on October 15th, which is National Pregnancy and Infant Loss Remembrance Day. We're going to make a big statement on the national lawn to show America and our lawmakers that enough is enough. We need to make change for the 23,000 babies born still every single year in the US alone. So please join us.
I'm
The big
so
push
excited to meet you
march.org.
guys. Anybody out there, I'm looking forward to meeting a lot of people and giving a lot of hugs. So it's going to
Yes.
be awesome.
Thank you all. Thank you, Dr. Florescue.
Oh, thank you.